parents, guardians, and members of our NACS community. As we work our way through the details associated with delivering remote learning experiences for the children we are blessed to serve, I continue to struggle to wrap my head around all associated with responding to a pandemic. The decision to close was not made flippantly. It was made with tremendous amounts of discernment and in consultation with public health and medical professionals. It was also done with an understanding for the magnitude of what the decision means for our entire community. I'm appreciative of Health Commissioner for Allen County, Dr. McMahon, for pulling together medical, public health, faith, business, social agency, philanthropic, school, and government leaders to help us understand, prepare, and plan for a pandemic. Throughout the process, each of us worked to find ways to keep life as normal as possible. It eventually became obvious that social distancing was the best way to slow the spread of the COVID-19 virus. It's important because slowing the pandemic is critical for our healthcare system. It must be able to continue tending to those with heart attacks, accidents and other trauma, births, cancer treatments, and others needing to make unexpected visits to the hospital and other healthcare facilities. It is critical because we must continue to protect our parents, our grandparents, and other loved ones who are either elderly or living with chronic health conditions that put them at a higher risk than the rest of us. Yes, for the vast majority of us, COVID-19 will result in flu-like symptoms. However, for the elderly and many chronically ill patients, the issue could be one of life or death. Unfortunately, many of these at-risk patients are also students in our schools. Slowing the spread of the disease, based on what has been shared with me, should limit the impact on the various sectors of our society that will be directly responding to the pandemic. The reality is that kids have the largest social networks. One child in a school who is diagnosed with COVID-19 will place hundreds of people in quarantine and not only place loved ones at risk, but also deplete the number of staff that we have available to serve our students. The instructional schedule has been posted on our website and sent in various communications. The schedule will be our guide for the next few weeks. We have entered uncharted waters. Remote learning is e-learning. However, it will be modified to accommodate households without or with limited internet. Remote learning is not a 1 or 2 day temporary situation, but a way of providing instruction for an extended period of time. We do understand that many questions remain unanswered. For example, we are working out details for providing meals to our students through the federal school lunch program. We are working out the details about delivering remote learning to those who live in areas where internet service is unavailable or severely limited. Conducting case conference meeting, delivering services identified in IEPs and LEPs, delivering peak services, and other details are still being worked out. Please bookmark our COVID-19 webpage to access more information as it becomes available. As we finalize details and find accurate answers to our many questions, we will post them on our COVID-19 webpage. This will allow us to communicate without overloading everybody's inbox. Please remember, we are living in unprecedented times. There is no playbook for us to follow. We are writing the playbook as we go. The world has not encountered a pandemic of this magnitude since 1918, when the Spanish flu caused illness and death throughout the world. All of us need to do our part to slow the spread of this disease and pull together as a community. This means each of us needs to stay at home and interact with as few people as possible during this extended closure. If we are sick, we need to isolate ourselves. If we have been exposed to others who are sick, we need to quarantine ourselves. As it was explained to me by a trusted medical professional, even if the flu is the cause of our illness, isolating ourselves will also slow the spread of it and reduce the number of people straining our healthcare system, which is already operating near or at capacity. We need to look out for one another. We need to help those who are isolated or quarantined. We need to maintain our sense of humor and our patience, and we need to follow the lead of our student activists and engage in random acts of kindness. We need to help those experiencing darkness and help them find light and hope through the kindness and sincerity of our actions, just as our marching band did last fall when they helped our community shine. Thank you for the opportunity to serve your children. Please be patient as we learn new ways of delivering instruction and educational support services. Please remember that we are human, and as hard as we will try to get everything correct, we will make mistakes. But we will maintain a growth mindset, which means that we will try things, reflect on the outcomes, and make adjustments and make improvements as needed with an eye towards continually getting better. Regardless, NACS is not going to lose sight of our mission to develop the talent and nurture the creativity of each learner. And we will continue to do so by providing healthy and safe learning environments that engage, support, and challenge each learner that we are blessed to serve. Thank you. Please help us pull together as a community as we work our way through these unprecedented times.